As part of KTAR's special series, Youth on Edge, today we're focusing on what is impacting teen mental health and what is going on in their world. I'm here today with Dr. Francia Day, clinical psychologist at Banner Health. Dr. Day, thanks so much for being here today.
Thank you for having me.
Why don't you go ahead and tell us a little bit about what your role is at Banner Health?
Yeah, so with Banner Health, I provide individual, family, couples therapy, to a wide range of populations, primarily working with adults, but I do have experience working with adolescents as well.
Great. And when we're thinking about what teens are facing in 2024, plenty of them have gone through some pretty intense times with the timing of the pandemic and just the state of the world right now. Why don't you tell me a little bit about what teens are facing currently?
Well, an important thing to point out is that the teenage years are such a pivotal, such a formative stage in development. It is when we start to develop a sense of identity of who we are, what kind of adults we are going to be. Now you bring into the picture the pandemic, and that stripped away some years in which we developed those social skills. And we did a lot of our socializing virtually online. So that became very normal. And then on the other end, we see social media, we see the online world presenting really unrealistic expectations. And as you combine those, here we are in a space in which, because they didn't have the opportunity to develop some of the social skills needed for the world, we see some anxiety. And then the unrealistic expectations that the online world presents also creates a sense of comparison. So here we are in a place in which I'm not pretty enough, I'm not strong enough, I'm not funny enough. It's all these people that I see online, and then we start to engage in negative self-talk. Our confidence goes down, and that's when we see the root of mental health issues. The two biggest ones that we typically see is anxiety and depression.
We saw that Mental Health America reported in 2023 that 1 in 10 youth in the United States are experiencing depression that is severely impacting their ability to function at school, at work. To speak a little bit further about those things that you're seeing in this age range, you mentioned anxiety and depression specifically.
Yes. So like I said, those are the two biggest ones that we see. The World Health Organization has actually put out some statistics that shows the fourth highest reason of death for people between the ages of 15 and 19 is actually suicide. Right. So we have seen the rates of suicide also increase. And again, because there has been increased isolation, difficulty connecting with other people, we see those seeds of depression, those decreased supports that are so vital to have a healthy mental health space.
And you touched on the pandemic specifically exacerbating that.
Yes.
Is that something that you see kids talk about when, they discuss what they're going through? Do you feel like they're pointing back to that at all as to why they're feeling this way?
Well, what I see more of in my clinical work is that there's this idea that socializing occurs primarily in the online world.
Sure.
Right? And this idea of socializing in our real world, or going out, having lunch with friends, doing so at school, feels almost abnormal. It is rather anxiety provoking because it's not as practiced, because here we have a way of socializing that has become so normalized, but doesn't develop those same skills that we develop when we're in person with someone.
What are some of those skills that might be missed by not having those in-person, early lunches, like you mentioned?
So reading nonverbals, right? When somebody's nodding, when somebody's smiling at you, some of the skills of that reciprocity, knowing when to stop talking, knowing what to talk about, how to follow a conversation. A lot of our socializing, especially for our teens, occurs through chats. So there's a lot more. It's choppier, right? And you try to read in between the lines. All those nonverbals are not there. And also just a sense of confidence. The way that we become confident with a skill is when we get to practice it.
Sure.
And because the pandemic created a good period of time in which we didn't have the opportunity to practice those skills, we're not as comfortable with them. And that's where we see the anxiety come in.
Got it. So I would not have thought about the practice angle there. Just as far, getting your reps in, of having those basic conversations.
Yes.
Is there any connection too as well of, you hear a lot from teenagers that like, oh, I don't want to make a phone call, or I don't want to be the one to order at, dinner.
Yes.
What kinds of things are you seeing in that regard when it comes to some of those, what we might think as like day-to-day interactions with strangers?
Those are also, can be very uncomfortable. And in more severe cases, really anxiety provoking. And if the anxiety gets so high that we avoid those type of interactions, then that's when we see the teen isolating more and more.
So it really sounds like, we have kind of the isolation that, teens felt during the pandemic has kind of built this cycle almost of, I didn't get the practice, so I don't feel good about doing this, so I'm isolating. Would you say that that's accurate?
Yes. And just like I said, the online world is just so normal to us. It's so much a part of our everyday lives. And because the teen years are such a formative developmental stage, that they're comfortable in the online world.
That makes a lot of sense. I mean, I'm fairly young. I'm in my early 20s. And so for me, the pandemic hit while I was in college.
Yes.
Whereas, for some of my sibling and his friends, it hit when they were in high school, right? So I feel like even the difference there as far as the timing for people, I'm sure has made an impact. But I feel like even the relationship with social media that I have versus what teens have, can you speak a little bit to, some of the social media habits or online habits that you're seeing either in, teens and young adults in your work?
Yes. What I am seeing is that seems to be a high level of comparison, right? Which naturally happens at that age. Again, we're trying to see what groups we fit in with, which groups we don't. And we see these individuals, that we connect with, and we're trying to make that connection. But through that connection, it's like, do I fit in with this group? Do I fit in with that group? Do I, meet the standards of what social media is creating? I should look like, I should act like, I should be like. that that can be confusing and unrealistic.
Tell me more about the ways that it can be confusing for people, for youth who are seeing these very polished forms of existing.
Yes. It can be confusing because then they start to question if there's something that they should be changing about themselves, something that maybe is not right about themselves, or just this sense of discomfort as to where do I fit in, and if the teen does focus too much on that and doesn't realize that some of these representations are, like you said, very filtered, it can create a lot of negative self-talk because we potentially don't meet those unrealistic standards.
Sure. Do you feel like teens are aware, at least, of that, I know, do you ever hear like, I know it's filtered, I know it's not real, but, I still am imagining myself in this person or comparing myself?
Yes. There does seem to be, at least in my work, some cognitive ability to realize that, yes, these are filtered. These are maybe not their everyday lives, but there's still this sense of, I want to achieve that. I still want to see if maybe I can get to that point. Or how come that is not the world that I live in?
I recently did some volunteering where I was teaching some like 3rd and 4th grade kids. And we were talking about, careers, what kind of things they wanted to be doing. And I would say more than half, you hear I want to be a firefighter, I want to be a teacher, but yes. So many were like, I want to be a YouTuber. I want to be an influencer.
Yes.
I'm just wondering, what are you seeing even now for teens who, maybe grew up, consuming YouTube in that way or consuming social media in that way. But, even now with these really young kids, what kind of progression do you think that we could see there as far as looking into the future a little bit about envisioning yourself in these famous, filtered, edited roles and people?
Yes, it's like you mentioned earlier. It almost has opened this entire new world of possibilities of what they can be when they grow up, what they would like to be. Now, whether a child and adolescent heads in that direction, there's also a complexity of factors behind it, right? Their connection to family, their engagement in more conventional groups like after-school activities, sports, all those type of healthier protective factors can play a pretty significant role in helping guide the child, the adolescent, to find a career or to find an identity that feels comfortable and healthy.
It's so interesting because I feel like there's a lot of pressure on teenagers and young people to have a really clear idea of what they want to do. Even you start getting the questions in like when you're 15, maybe sophomore year of high school. Well, what do you want to major in? Do you want to go to college? Do you want to study a trade? And with this kind of other realm of, social media and internet culture in particular, do you think that pressure is being either exacerbated or focused in that area because it is so present in these teens' lives?
I think it really it's very individualized. It really depends on the teen and on the family, on the other people around them, because you are right. Early in adolescence, a lot of our teenagers do get those messages like, what are you going to be? Are you going to college? You need to start preparing now. And those are really heavy big questions that can be difficult to answer in your 20s, much less when you're a teenager, because at that stage, you're just beginning to figure out who you are.
With it being such a delicate or formative period in people's lives, are there steps that either teens themselves or their families can take to help maybe lessen some of that pressure, or, reduce some of these like points of comparison in their lives? Are there steps that they can take?
Okay. Well, a protective factor that we have seen is having a good bonded relationship with a parent or a caregiver. Now, a parent or a caregiver spending time with their teen. It doesn't have to be anything expensive or big. Having a movie night on Fridays, going for a walk, though, that creates that bond. And then also having good communication between the caretaker or just any adult, any healthy adult that is in that teen's life, that be a coach, that be a grandparent, that be a sibling. And communication doesn't mean lecturing the child as to, you need to figure out what you're going to do for college. Have you been looking into X, Y, and Z? That's lecturing. Yes, providing guidance is important, but there is also the piece of learning to listen, right? Acknowledging the teen's emotion, acknowledging that they may be confused and not know, right? They might be leaning towards science and then realize they really don't like it. Allowing them to tell you, problem solve with you, share with you that all the thoughts, all the critical thinking that is going on with them. That level of problem solving through supports only happens if there's a good bond there.
Interesting. Having seen plenty of teens kind of in my generation grow up with a wide variety of supportive family members and families that put a lot of pressure on students, or families who, are reliant on students to support them potentially financially, or even just to, carry on some kind of legacy, right? There can be a lot of familial pressure there. Is that something that you're seeing an impact when it comes to, the struggles that teens are having?
Yes. That sense of pressure can create a sense of division, of alienation, because they do want to potentially please the family, do the right thing. However, they're feeling the anxiety, the pressure of trying to figure out how to do that and still be true to themselves, try and figure out who they are. That's why I mentioned that a good bond, good communication, that it's not just the lecturing type, this is what you need to do, this is what you shouldn't do, but hearing them out as to where they're at is so detrimental.
With teens being so online and many really engaged in discussions of mental health and anxiety, do you feel like this generation of teens have a particular awareness of mental health and, are already having some of those conversations?
Yes. I would say a positive that I have seen come out of a lot of what we had to deal with the pandemic is that mental health did come to the forefront a little bit more. Yes, there is still stigma there, but I think we chipped away at it. Now, mental health, we're starting to have those conversations and take away some of that stigma and realize that mental health is just part of health. And I think in that generation, there is more potential to normalize. And some of these experiences are normal. Some of these difficulties other people face as well, that they don't have to feel alone, and that there is support out there, and hopefully feeling more comfortable to reach out and get that support. Of course, that depends on a complexity of other factors, family, the culture, right? But having those conversations is the start to feel comfortable to reach out and get the help that we need.
And we talked a little bit about how, oftentimes teens are looking to these like social media platforms to see a wide range of people, and, may find that maybe there is somebody who is working through their own diagnoses. Maybe there's somebody who is, posting about their experiences with mental health and the work that they're doing as far as like this, hey, this was my experience, feeling a lot of anxiousness and, pursuing some kind of therapy or treatment or support in that regard, and seeing themselves in these people. These teens might be seeing themselves in these journeys. Do you think that social media can have a somewhat positive impact in that regard?
Yes. Social media, I think, has the possibility of being both a wonderful resource, but also a source of struggle. But because it connects us to such a wider range of people, right? It opens up the world, really, and it has the opportunity to connect us to those that are willing to share their journey online and help us feel maybe less alone in that journey.
The other side of that also, especially as somebody like myself who is in media and journalism, there's a ton of misinformation out there.
It's true.
Can you speak a little bit to that aspect of things as far as, like you said, the world is open. There's plenty of people out there who then, use that as a platform to speak without some kind of expertise.
Yes. Like we were talking about, the online world is a double-edged sword, like a lot of things in life, right? It has the opportunity to connect us. It has the opportunity to teach us, but it also has the potential of spreading information that can be very damaging. And that can occur for just about every age group.
Okay. To pivot a little bit, speaking as somebody who is in the medical and mental and behavioral health world, what are you seeing the conversation being in that world when it comes to mental health, particularly in adolescence?
I would say that the conversation has been trying to find ways to support, right? Trying to take away barriers for resources, trying to see how we can get more of the adolescents that are struggling to be able to get the help that they need. That's why resources are changing. Now we have the National Helpline 988, which is a mental health resource. Now we're seeing mental health services go into the school rather than the parents having to take them out of school to bring them to a clinic, right? So we're really trying to make what they need more reachable.
In some of the research that I've been doing, we've seen that on some national scales, Arizona does not rank very highly as far as access to mental health resources for youth in particular. Can you speak to that at all as far as, what is going on in Arizona specifically, if you can speak to that?
Well, I think there's, again, a complexity of factors that go into that, political ones, educational ones. But in any case, I think parents can be such a pivotal tool to take that first step to, if they see that their teen is struggling, to connect. Because although we may not be ranked very highly, if we seek them out, there are some resources out there for them.
Excellent. Okay. I think that's all of my questions that I have today. Is there anything else as far as things that we didn't talk about, an angle that we haven't discussed that either you want to highlight or a key takeaway from our conversation today?
I would say an important takeaway is that we should talk to our teens, see where they're at, hear them out. And if someone who is listening is a caretaker, a parent, a guardian, really guide your adolescent to be part of a healthy group, such as a sport, such as an after-school activity, such as even a light job. Reason being is that an adolescent is going to want to connect. They're going to want to feel a part of some group. So if we guide them to be part of healthier groups, that can really help their confidence and their mental health. When things don't go well, teens, just like the rest of us, are likely to experience frustration, hurt, right? So those are very normal emotions when we feel like things didn't go our way. Now, if a teen lashes out or acts in aggressive ways, there's a complexity of risk factors behind that can determine if that's the way that they're going to express their emotions. It just depends on, like I said, a variety of other factors as to how that teen, whether that teen has the skills to express themselves in a pro-social way, if they have the ability to manage emotions, whether they have the support, or whether they have seen violence before and they think that is a way of getting respect, getting heard, right? So there's a complexity of factors behind that.
I see. As far as, kind of what we have seen fairly recently with some groups of teens acting violently together,
mm-hmm.
is that the kind of factor that, might encourage those behaviors?
Like I said, yes, anger, frustration, those can be a factor, but there's a number of risk factors that research has found in the individual, in families, in social interactions as a whole, that can create that perfect storm for teens to connect with maybe unhealthier groups, or feel like they will be respected, heard, seen through aggressive behaviors. But like I said, it's a complexity of factors, really.
Can you give me a few examples of what some of those factors might be?
Yes. So as an individual, some of the risk factors that we have seen for adolescent violence is adolescents that have shown that have engaged in illegal behaviors before the age of 12, have engaged in substances before the age of 12, have shown some aggressive tendencies early on in life have lower academic achievement. In terms of the family, the risk factors that we've seen are teens that maybe don't have a sense of bond or connection with parents, parental discipline strategies that are either too lax or too harsh, homes in which the adolescent was exposed to violence, either to them directly or they witnessed it. And in bigger social risk factors, we also see gang involvement. Gang involvement is highly correlated with adolescent violence. But as I had mentioned earlier, we also see that teens that do engage in violence typically are not involved in other healthier conventional groups like sports or after school activities or some kind of group that they already feel a part of.
Got it. They're potentially, filling a gap that they might have in their life when it comes to making those connections.
Yes. So as we had talked earlier, the adolescent years are so important in identity development, and we want to feel a part of something. We want to feel that we fit in somewhere. So if we don't feel like we fit in more of those healthier pro-social groups, there is that risk that they will find that through gang involvement or just unhealthier groups.
Okay, awesome. Thank you so much for speaking with me today, Dr. Day, and giving us a moment of your time here.
Thank you. Thank you very much.